right, so we finally made it out the OR. So now we're going to our post-op phase. So like I said, in our post-operative phase, that is once that patient gets to the PACU. The PACU is where that patient is going to recover from what? From the anesthesia. So once that patient is with PACU, and PACU say that, guess what? This patient is alert. They were able to wake up with off the anesthesia without any issues. They'll send them back to the floor to you. So or if they were under like some lighter sedation, they could send them home with somebody driving them home. So definitely doing your post-op, this is your biggest area as a nurse, because this is your job. You're going to literally be the eyes and ears for the doctor. So our biggest focus is safety, but airway, 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 ABCs. So we want to make sure that the patient is maintaining oxygenation and ventilation, right? We're going to give them supplemental oxygen as needed. We want to assess their breathing, right? We want to assess the shallowness and the depth of their breathing. We want to look at their respiratory rate. We want to do a complete respiratory assessment, because that patient just got off anesthesia, and we know that anesthesia, our respiratory and our lungs and all that respiratory muscles, all that stuff was paralyzed. So now we have to wake the body back up, and a lot of people don't get up at the same rate as others. Some people, they are easily awakened at the anesthesia, and then others, they have to stay in the PACU for hours. So we want to make sure we keep the head of the bed elevated a little bit unless it's contraindicated. So if the surgery say that the patient has to remain flat, then they have to remain flat. They may require suctioning. If vomiting occurs, you want to turn that patient to the side. So you want to make sure in your PACU, in the PACU, and when they come back from the PACU, that each hospital has their own policy on how often you have to check the vital signs. But I know it's like every 15 minutes for like an hour, 30 minutes for every 2 hours, and every 4 hours for the first 24 hours or something like that. But we're just making sure that we're assessing our patient vital signs, because our blood pressure can show us if our patient is having a hemorrhage, if our patient is going to shock. We want to make sure that we have IV access, that we're checking our IV to make sure that it's working. In case an emergency go down, we're not trying to get an IV, we already have it. During this phase as well, you want to go ahead and talk to your patient family members, let them know, hey, they made it out of surgery fine, they're recovering in the PACU, and they will be back to the floor once they fully wake up and all that kind of stuff. So you want to make sure that you keep the family updated, because family is important, because they are dealing with a lot of anxiety as well. So in the PACU, in that, after they're recovering from anesthesia and all that kind of stuff, the PACU nurse, they don't really initiate your post-op orders. You will have to initiate your own post-op orders, which is your floor orders. So your PACU nurse, they will be medicating your patients for pain. They can do that down there. If your patient is nauseous, they'll medicate them down there. But actually following the orders for post-op orders, that's not the PACU's job. So post-op complications, we will be going over this in class, but I still have it here, but we definitely will be going over this in class. All right, so we talked about DVTs already, but like I said, we're going to go through all this in class. All right, you guys, this is the end of the surgical lecture. So please remember, we are going over the post-op complications in class. They are here. I suggest you start studying them now, but we're definitely going to go over these in class. If you have any questions, reach out to me.